Good afternoon. Thank you very much. Thank you very much for joining us in the salon, our weekly gathering as part of the Dementia Researcher community. I'm Adam Smith, and it's my pleasure to be hosting today's session. This week, we're exploring a topic which is both inspiring and crucial. It's civil engagement. We'll be considering how we as researchers can step beyond our lab or our desks to influence public policy, to strengthen community support and shift societal attitudes, not because it's your job, but because it's the right thing to do. And it's important to challenge ourselves to think about the broader impact of our work and to explore innovative ways to advocate for better care, support and awareness. And we're delighted to have two brilliant guests who are hopefully going to turn their cameras on now to talk to this topic. We have Dr. Patricia Kelly, who is a lecturer in neuromuscular and neurodegenerative researcher at Ulster University, whose 12 plus years of experience in Alzheimer's research and a commitment to improving patient care bring a unique perspective to this discussion. We also have the brilliant Dr. James Rupert Fletcher, who was, I think, one of the very, very first guests on our podcast back in the day, kind of years ago. I don't know if this is the first time we've ever had you back as well, James. Hopefully not. James is an assistant professor in digital futures at the University of Bath, whose research spans informal care networks, anti-stigma campaigns, dementia-friendly initiatives, and preventative public health strategies. And each of our speakers today are going to share their thoughts on the role of civil engagement in their and their own perspectives on delivering this kind of meaningful change and on this important topic. Following their talks, we're going to have a chance for you to ask questions as well and to share your own experiences on civil engagement. And I think Patricia's going to go first, but I have to admit, first of all, I'm really looking forward to this myself, because this wasn't in our original list of topics when we said, hey, we'd like to set up this weekly webinar. We asked, but invited potential speakers to suggest, and this was a topic that was suggested. I don't know if it was you, Patricia, who suggested this. Oh, yeah. And at first, I kind of scratched my head and went, "What's that?" And because I have to admit, I didn't know what civil engagement was. Not badged in that term. I've done my research since, and I'm more aware. So I don't know if our audience feel the same way as me, but I'm fascinated to learn more. And I think from what I've read already, it sounds like you might already be doing some of these things. You just don't realize they are what they are. So I'm really looking forward to hearing. And Patricia, I think you're going to go first.
Yeah, thank you very much. I'm delighted to be invited to speak on civil engagement. Yeah, I've already just taken the floor. Thank you very much. So delighted to be invited to speak on this topic. And this is something that is incredibly close to my heart. And this started back when I was a master's student in 2012. And I had just signed up as a new student to Alzheimer's disease research. And it was through personal experience, through my mum, who was caring for an elderly neighbour, that I got interested in what was different between her brain and my brain, and why she couldn't remember and I could. And I was fascinated about what was happening pathologically. And so as a master's student, I signed up and realized that there was so much that I needed to know in order to help my lab work. So I became a volunteer with the Alzheimer's Society, and I was traveling to Strabane in Northern Ireland. It's a nearby village. And then I was going to the city of Derry, Londonderry, and I'm currently living in somewhere very rurally isolated. And, you know, I had been all my life. So this little village of Park, you know, in Craigban, Claudy, so it's a bit out of the way. And I'd been traveling to nearby villages and in the city with the Alzheimer's Society, and we were doing wonderful work. We were helping dementia patients and their caregivers to have a bit of respite, and also to have a social interaction and what they call a memory cafe. And I was also helping caregivers, and I was learning from caregivers. This was my motivation for being there initially, was to learn, and to learn from the patient, and to learn from their experiences, and to figure out what the day-to-day was like for patients with dementia. And so I was doing this over the years and fundraising for the Alzheimer's Society and loving this. And then I thought, why isn't it that we don't have anything in my local community of Park, the Lermont Community Centre? We don't have any, any services. We don't have any connection with the Alzheimer's Society. And so I spoke to the manager of the Lermont Community Centre, and she had said that she was finding it very difficult because at that time she was running a lot of age caring groups, and a lot of dementia patients were actually falling away from the group. And that meant that they were becoming increasingly more isolated because they found it difficult to attend the session and their activities because they were finding it difficult to engage, and they were becoming isolated, and she didn't know how to reach out and to help and support these patients. So I didn't realize at the time, but there was actually 120 people with dementia in my local community at that time, and this was now 2015. And so I got the Alzheimer's Society in, and I set up workshops, and we set up a caregiving support group, and we set up a social luncheon group specifically for dementia patients. And this has been running since 2015. So we became the first rural dementia-friendly community to become registered with the Alzheimer's Society. And this has been a proud badge of honour for Park for almost 10 years. And then I started to realise that dementia care and awareness was for everyone, not just specifically for patients with dementia, but for everyone. And I think the profound effects of this dementia change, or the dementia support in the community, was realised when I was given a workshop in the local community, and it was with the resources from the Alzheimer's Society. So I was talking about what it was like to have dementia and how could we best support patients with dementia in the community, and these low cost, no cost changes that business owners could use to better support and reduce the challenges and help people live more independently with their diagnosis. And it was at that time, at the end of the workshop, that a gentleman in attendance came up to me and said that this was the first time that he could now begin to talk about his diagnosis. And he had been diagnosed for 3 years, but he felt because of the stigma, he couldn't talk about it. So this is wonderful to, open up the conversation. And then also there was one day a neighbour approached me and said that her mum had been diagnosed with dementia and she didn't know what to do. So I was able to signpost her to the dementia, friendly community centre. And they were able to tell her all about the Alzheimer's Society and support that she could get and to better suit her needs, whereas before she wouldn't have had that support. So I'm very proud that Park is continuing to be dementia friendly, and that patients who have a diagnosis don't necessarily feel like they're, can't get engaged in the community and attend their activities, and that people can understand and help and support people to live more independently. And so I've also realized that there's the other side of it, that it's not specifically a dementia-friendly community is not specifically for patients with Alzheimer's disease and dementia and their caregivers. It's also what we can do to protect our brain and reduce our own risk of dementia. And so with that, I started to develop workshops and roll these out in the community, and so that I can help people realize that they can take their health into their own hands and what they can do to help keep their blood vessels healthy, to understand the concept and the importance of brain health and long-term brain health, and not just looking at short-term gains for health, but looking at it over the long term, almost like a retirement policy, or where not only are you considering your retirement financially, but also in your health and well-being. And so just talking about simple strategies that they can do and simple changes that will have long-term benefits, so that we can, as a community, help to reduce our own risk of dementia, taking our own health into our own hands and becoming more widely aware about the concept of dementia friendly. So together we can help and support patients with dementia and caregivers, but also we can support our own health. And so this is something that's very close to my heart. And now my mum has been diagnosed with dementia and Parkinson's, and I am her full-time care. And it just so happened that from a personal story, we were in A&E, and I had just popped out for a cup of tea and to bring her back a cup of tea and a sandwich while she was waiting to be triaged. And I said, are you okay to wait here? I'll just be 2 minutes. And she said, yeah, I'll be fine. But when I had come back, she wasn't there. And she wasn't in where the nurses and the doctors were. She had, for some reason, taken herself over to another part of the hospital because she thought she had to go to radiology. And it was then a nurse called me and said, we have your mum. So that nurse found my mum wandering confused in the corridor. So I realized the importance of a dementia-friendly community, and that simple phone call made a whole world of a difference to me, because I was able to help and support and continue to support, mum and A&E, because there was no way that I would have been able to find her. So it's about what we can do, these small things that make a massive change, and not only for patients but also for ourselves. The small things that we can do for our own health and well-being, so we can better protect our brain. So thank you very much.
Thank you very much, Patricia. I'm interested to know what came first. Was it your involvement in this kind of advocacy and public engagement, or was it your research career? What were you already working on researching in dementia when that started, or was it the other way around?
Yeah, so it started during my master's degree at Ulster University, where I was looking at the blood vessels and Alzheimer's disease. So all my research is predominantly in the lab, but it was during my master's that I realized there was so much more to learn about Alzheimer's disease that I could learn in the lab, and I actively wanted to learn directly from patients and get to learn from caregivers. So it was to better support my master's studies, but then I realized that it actually was my why I was doing my master's and why I progressed to my PhD, because I realized what families are going through and what they need, and the need for treatment. So that spurred me on, and so I think they're both very complementary.
Absolutely. I mean, I completely agree. I mean, it's great as well being a fundamental scientist, because I think quite often people I know who've become involved in community and from their own inspiration have tended to be kind of qualitative researchers and people who have interaction daily with people living with dementia as well. So I think I'm not saying it doesn't happen, but I think it's certainly more unusual, I think, for fundamental scientists to go out and do that directly with people with. I know some fundamental scientists who have barely ever met anybody living with dementia beyond perhaps a family member. So how do you think that work in that area has impacted you as a scientist?
It gave me a broader understanding of the disease and the process and what people are going through, and it better prepared me then to take care of my mum, which I didn't realize that I was going to have to do. I didn't expect that she would, develop dementia. But now now having an experience of what it's like, and how to provide care and reduce challenges and better support and understand the journey that people go through, I can best apply that. And as for a scientist, it made me aware about how privileged we are to have access to such important information regarding neuroscience and health and well-being that members of the public don't necessarily have direct access. And if they do, it's written in such a way that they may not understand without the experience. So to be able to deliver that and help people realize what they can do for practical changes so that they could better improve their own health, this reduction of risk for dementia, I think it's all very important. So it's been an important part of my career.
I love that you're in that space. It's something that I often encouraged, because basic scientists, fundamental scientists tend to kind of go to those conferences which are with other scientists. And I think I've often encouraged and said, no, you should go to these kind of other ones which are looking at policy or looking at qualitative research and care, to say, I think you really do benefit from having that interaction with people with living with mixed vision. Apart from anything else, when you're at your lowest, when your experiments aren't working, it really is kind of motivation, right? Because I don't know about you, I like to have a direct line of sight between what I'm doing and the people who are going to benefit as a way of motivating. And I think it's quite hard if all you're doing is just working with mice, or, you know, the disease is your focus rather than the people who live with that disease. It brings it to life, doesn't it?
Yeah, I definitely agree.
And James, we'll come to you in a second. I've got one last question for Patricia before we move on. Is what advice would you have for anybody? Because you started that from scratch. I mean, it's not like this was already going. I could imagine that. I mean, I live in a rural community in South Oxfordshire. I've looked before, a long time ago now, as to what kind of support was available for people living with dementia in my own community, and found that there wasn't a great deal. The NHS had some stuff, but it was clearly stretched. There wasn't a memory cafe in the area or anything like that. What advice would you give to somebody like me who wants to take time out, not because it's part of my job, but to do that kind of stuff?
Brilliant. Thank you very much. It's a great question. So my advice is to link in with your community centre and find out how they could better facilitate for patients with dementia. And if there's capacity there for them to set up a memory group, can they link in with dementia charities, local dementia charities? We have a few here in Northern Ireland. Can they link in with the Alzheimer's Society? Can the Alzheimer's Society have support that can come into the community centre? And can they then have caregivers to meet? There's also training that the Alzheimer's Society provide for caregivers. And can this training then allow the caregivers to, come together as a group and then to more regularly meet, and how they can support? I found that it was all driven by need. And it's just profoundly changed how Park and Lerma Community Centre see and help and support patients with dementia. And I would love for this to be rolled out to other communities. And we were going with no budget, so it's not like we need a huge, budget or a huge financial input into this. This was just driven by need and driven by passion. And now to see the support and for the dementia patients and their caregivers to meet every week. And there's about 5 volunteers within that.
Wow.
And that's within that session, so they're well supported. And then that also allows those volunteers to better understand dementia and understand personal journeys and what people are experiencing, and as a community to be able to pull together and learn, and it's all about learning. And because someone said, I think it was a neurologist, said that when you see one dementia patient, you've seen one dementia patient. We're all different, so there's so much to learn. And so I think go for it is my advice.
And that was 9 years ago now, of course. And I love the way that you didn't start with any preconceived ideas of, we want to start a support group. It's kind of listening and how that's developed onto talking about brain health now and emerged. And I guess starting by talking or finding people in the community to talk to understand what they actually want locally. Do they want just to come together and somebody to talk to once a week and have a cup of coffee, or what is it exactly that people need? I think sounds like a great approach to start with, and then you can build up, can't you, to brain health, and you can build up to more serious campaigning, because I guess at some point you realize that whilst it's possible without money, having some money would help, I guess.
Yeah, there was a few things that I didn't understand that I thought that was important to tell the community. And I've held these workshops and they've been so well attended. They've been up in 50 attendees, because there's some research to support that you don't, just because you're 60, 70, 80 years of age, it doesn't mean that you've lived your life and you can't now make profound changes to your brain health. They've shown in the literature, by making improvements over 2 years, that you can improve your brain health. And it's also, that's not like you have to wait until you're much, much older to find out if you're going to get dementia. Yeah. You can make active changes now to, help your blood vessels, to keep your brain healthy. And I think it's better to keep your brain cells healthy rather than trying to resurrect them, for therapies to try. But, I think prevention is key. And these are important things to discuss, and just to have a room full of people that are interested in the brain and to talk about the brain and find out how important it is to keep it healthy and for strategies that they can use and to learn from each other. You know, it's more than just my voice. It's all the collective voices that we can open a discussion. And I think these are important things to take our own health into our own hands. And it's so funny that I'm up talking about health and with all these bad habits of my own, but maybe I'll learn
Well, no, you make a good point there, I think, as well, because I think there could be this, because we talk so much now, don't we, about the importance of midlife for that long term, that I guess there could be an attitude that says, oh, well, it's too late for me now. There's no point in me starting to. So I guess whilst those brain health things might be more beneficial not more beneficial, are beneficial in middle age, that actually still targets that later audience, older people, is good too, particularly vascular dementia, where we know you can actually, lifestyle changes can change disease course. And I guess when you're bringing in people with lived experience for your community support, it's kind of important that at least if they are in a partnership in some way, that the other person that's caring for them doesn't become sick themselves. I mean, they need to stay healthy to be able to provide that support. I'm gonna wrap things up there and come to James now. Hi, James. Thank you for being so patient.
Hello, not at all. No, that was really.
We'll come back again and over to you, and we'll come back and talk some more after your talk.
Yeah. So Adam obviously gave me a very nice introduction. It is very nice to be back with Dementia Researcher after all this time. So I actually, despite now working in a management school, have a background in medical sociology, critical gerontology, and dementia studies. And the sort of critical caveat of that is this idea of critical theory, where we're super interested in how different aspects of life are political, and also importantly how we can sort of get involved in that politics and transform it. And so I think about dementia in that way, and so really I'm interested in dementia as a political entity. And you might think of that in a really big way, some super obvious ones, like what does it mean for a government to try to increase diagnosis rates or to put less emphasis on diagnosis, these sorts of things. There are also sort of more hidden preventative type things. So for instance, the things we were talking about just then. If we think about something like housing inequality, that is a massive driver of the kinds of things that people are exposed to, and will have a huge impact on their brain health across various different exposures. And then there's also like the small politics, or what we call the micro politics of dementia, and that's the really like intricate things of everyday life, the way that we relate to one another. Why is it that people will tend to ignore a person with dementia, or talk to their spouse about them rather than talking to them directly? So these sorts of quite intricate everyday personal politics of dementia. And I guess that ends up making my work fairly civically engaged, almost automatically, because it deals with those sorts of things. And I think, as Adam mentioned, it's probably a little bit more impressive the extent to which Patricia's involved in civic engagement, because bench science can sort of lend itself less naturally to that sort of stuff than the kind of work I do, because a lot of my work takes place in public. So I would say that I rarely engage in the sort of policy world. I mean, I think it's not the particular politics that I'm interested in dementia. I would say that the kinds of things that I'm interested in are much more embedded in sort of public life, the kinds of everyday things that we live and are familiar with. And the last thing I worked on was public transport, and I'll talk a little bit about that. I think another important aspect of the kinds of work that I do is that I'm really interested in creative methods. So methods for documenting people's lives with dementia in terms of making films, photography, soundscaping, sketching, these sorts of things, and also methods that get people heavily involved in the doing of them. And again, they tend to be things that lend themselves quite readily to civic engagement because they're relatively accessible and they're also quite fun and engaging, which is always is really nice. So some of the sort of civic engagement, what you could classify as that out of my work, is really straightforward stuff. So it would be your classic disseminating research findings in an engaged way type thing. So for example, my previous work on dementia-friendly public transport up in Manchester, we recently launched a film. We had a film festival that where we launched a film to the public that had been made with passengers living with dementia around Greater Manchester, and that was a really great way of engaging with the local public about that issue. Another example that springs to mind that was super interesting to me was that my PhD work was involved in this immersive theatre event that was focused on getting audiences to sort of reflect on their own potential later life care needs. I guess not dissimilarly to what you were talking about there, Adam, in terms of reflecting on provision in your area, but in terms of really getting people in middle life to think about what that might look like if they, had dementia later in life. And so my work from my PhD, which had been involved in how different people relate to and interact with people with dementia, was involved in that, and there were sort of actors who were pretending to be care staff and things like that who would interact with people as if they were an older person with dementia, and in the sort of bad ways that we might expect, like ignoring them and infantilizing them and those sorts of things. So there are like really interesting, creative and super engaging ways that you can sort of engage with the public in a very straightforward, my research found these things and I'm now going to tell you about it type way, which is really cool and I have a lot of time for. I think what's more interesting for me, particularly in that sort of kind of critical space and working with creative methods, is the idea of the methods and the research itself as a form of what we'd call praxis. And that's really this process of like taking your theory and your ideas and putting that into solid practice. So actually doing the things that you're talking and thinking about. And I think if you take a view that dementia is something that in many, many different ways is quite fundamentally shaped by politics, then it's difficult as a researcher, and as with most people, I have lots of personal experience of dementia. It's very difficult to then resist not becoming actively involved in that space and trying to see your research as a sort of a means of political activity in itself, as trying to do good things for people with dementia and to improve life with dementia, and particularly civic and public life with dementia. And so the way that you can start to think about doing those things is to try and have public activities and public action designed into the methodology itself, so that public engagement becomes a means of doing research. And the easiest way of doing that is simply by going out and engaging in civic life as a means of studying it. So this transport work that I did in Manchester was super interesting because we, would have our fancy new iPhones to make the films and do the photography and that sort of stuff, and then go out and ride the buses and the trams together and record the kinds of things that were happening, and sometimes that would spark conversations that might not have been sparked otherwise. So it's like actively intervening in the civic space as I travel around with passengers with dementia, and it's like enabling them to be actively involved in the research, because they are generating the data and to an extent also functioning in the analysis by like reflecting in real time on the kinds of experiences that they are having. And obviously really the most important aspects of public transport, particularly buses, can be those sort of public interactions, that sort of civic life that we often take for granted. But, you know, things like stroking someone's dog or talking to someone about their baby and all this sort of good stuff that really animates our social life, super important to everybody, super important to people with dementia as well. But that sort of becomes ingrained in the research process itself, which I think is a really nice way of doing research. Another example of like trying to move that civic engagement into the research process itself is this current bid that I've got going through, where we're trying to set up these public workshops that will include older people with dementia to design personas. So you work on sort of crafting these personas that articulate some of the characteristics that different local people have and different needs and preferences that they have, as a means of then making a training package for local transport staff. And again, that's a really nice way of getting simultaneously publics and people with dementia involved in the research process itself in a creative way that's really engaging and fun, and is a means for people to have really positive interactions with one another. But it is also a form of research. We are going to take the findings from that, and we are then going to convey them in a traditional way into the sort of the transport staff training. So it's always thinking about these ways that we can sort of engage civic work in research. I could go on with the examples for ages, which is maybe not that helpful, but I was thinking another one is that we set up a sort of crafting cafe for people with dementia and members of the public a few years ago in Manchester. And again, we were using that as a research exercise, but we were also using it as a means of establishing some positive civic space for these interactions, and also getting research and university resources out into the community to do that good stuff. And ultimately all that stuff is fantastic, because I think research fairly consistently shows that if you can bring people together and fashion these sort of fun, positive interactions, that is really the ultimate way in which you intervene in society. It's incredibly hard to hold these sort of prejudices and stereotypes and ideas about how you might behave towards a person with dementia when you're actually there with people in the flesh and talking to real people and really encountering individuals who happen to have a diagnosis of dementia, rather than the idea of that you've got from the popular press. So I think maybe the final thing that I will say is, because I actually mentioned it a little bit there, is the idea of like getting resources out as a form of civic engagement. So I think during say my 10, it's not quite 10, but almost 10-year career, there's been this huge tension wherein I think in my personal life you have, well, public services generally, but dementia services particularly, relatively impoverished, really struggling, again, entirely political. And then you have dementia research, which has been relatively well funded, relatively well supported. I mean, you look where we are right now talking on the Dementia Research platform. We're insanely lucky to have this and to have the work that, Adam's done over the years to support early career researchers like me and others. So we actually benefit from a wealth of resources. So there's a slight tension between those things. And I think that really good civic engagement tries to sort of slightly re-socialize those resources and take them and think, okay, my university's got a fair bit of cash from a funding body here. How can I get that out? And there are various ways that, you know, by building people with dementia into grants themselves in different ways as consultants or care partners into grants, or even to, you know, pay organizations decent amounts of money from grants, or to try and set up initiatives yourself. That can then be a means of getting those resources back out again. And I think that's really great if we can move beyond the first bit of civic engagement that I spoke about, in terms of, I want to take some research findings into the community, and actually to start to think about research itself as something that the doing of it can have positive civic effects. And that can be through just super enjoyable research that people want to get involved in and is fun and changes the way that sort of dementia exists in civic life, or in terms of actually giving people the resources and trying to quite materially improve circumstances of people who are often struggling with or without dementia. Because I think Patricia's entirely right that this sort of work, the civic engagement work about dementia, really typically just benefits people with or without dementia, right? If you think about having a slightly better maintained bus or a friendlier bus, that's nice for everyone. Doesn't really matter the diagnosis that you've got. So yeah, they're sort of my main reflections on civic engagement in my own work. Yeah, that's about it from me.
Fantastic. Thank you very much. And you kind of in here, I've got all these kind of I'm furiously writing notes and writing down questions, because you're right. I started this whole conversation by saying you do this because it's not part of your job, but actually, if you're really lucky, you can get to either it is part of your job because you're, you know, even just as a, you might work in the policy space, or you might work in as a researcher who either took this on and civil engagement is part of the research you're doing, and if it's not, you have the opportunity to build that in, particularly in qualitative research, obviously not, well, maybe not so much in fundamental science, to make sure. And I think at the moment this is where there can be a gap, can't there, between, as you said, James, between you can do civil engagement during your research. It's what happens when that research stops. It's the legacy of that, where potentially if you're lucky, or if you've designed this well, the end product either left a legacy through the research you did, or the product of the research is something that's implementable and picked up. And I think that's where we know there are gaps at the moment, because, you know, if every good intervention or idea or policy or framework that's developed by research was adopted, we'd be in a much better space than we are, but they're simply not, are they? And so you've managed to bridge that gap in really your civil engagement's been, you've been able to do that through your work.
Yeah, I think I had there's sort of a story as to how that's involved. So I mean, I have a long background in informal dementia care. So basically was always an informal dementia carer up into my mid-20s, so sort of right throughout my life, with just the churn of various close family members. Yeah. And I'm from a family that never really engaged with services, and you know, the fact is that I think in our space we're told to think about impact in a very certain way, but there's a lot of people in the country who sort of live slightly outside of the policy sphere as we imagine it, in terms of, you know, you don't pay taxes and you don't use services. Like, that is there's an informal world that exists outside of the formal world. And so I'm really interested in that sort of everyday life. And so I think that I started working on that sort of stuff, and it's fine to then be a little bit skeptical of policy and to think, okay, well, I might design a really nice intervention, but actually is it going to influence the people who need it? But then I think the problem is you then start to think, well, right, what's the point in research? Why? Well, what's the payoff? And actually, that is when I really became interested in those more immediate engagement effects, in terms of, well, you know what, actually, I'm in a really unique position of having a pot of funding behind me and a whole set of tools and these sort of wonderful theoretical ideas that could be put into far better practice. And so then you start to think, well, actually, what about if just the day-to-day doing of research could actually be doing that good stuff, right? You can go out and do it immediately. You don't have to think, well, in 10 years' time, I would like to be involved in a policy discussion about this.
Do you know what? That's a really good attitude, I think, to have as well, is even if what you do at the end doesn't have that long-term impact that you'd like it to have, the fact that you are there in the moment doing good with people that are going to benefit there and then, I think you've helped, haven't you? You've contributed. And I absolutely pick up on your point about communities that don't engage with services. There is, I think all too often we know the people that advocate and represent people living with dementia aren't necessarily representative of everybody. I think they'd acknowledge that. This isn't to in any way dumb down their contribution, but the kind of, I'm guessing the people you're talking about would never come out and do these kind of talks or do public and patient involvement. You've got to make the effort to go find them and talk to them, which actually brings a good question in. This is a good point to raise a question from one of our audience members, John, who asks, I'm planning to engage with queer men living with dementia for my research access in dementia care services. What tips would you give for engaging with underrepresented communities like LGBTQ plus community? I don't know, James, you want to take that one first?
Yeah, I mean, that's it is not a community that I have ever worked with, so I'm very wary of trying to draw links across. I would say that, and actually, you know, in the same way that you were just discussing, I think that we often think about groups who have historically been more hesitant to like formally engage with services, but of course, very, very good reasons for that. Like I entirely understand why people, and it's not really about engagement, right? It's that people have been historically treated very badly by systems, and so therefore no longer really want to engage with them. So I think that is super important to come at it from that place rather than a more traditional public health place of these people don't engage, that's bad, how do we get them to engage? And I think I would emphasize that point about you don't have to swallow the academia pill of what good impact and what good engagement looks like. It can just be doing good stuff day to day, because actually that's the stuff that really matters. Like some of the best impact I've ever had is two of the people in my study who effectively used me to re-engage with public transport post-COVID, because obviously COVID, massive hit to everybody's mobility, but particularly people living with disabilities who then found it really difficult to re-engage with the system afterwards. And there were two people in the study who effectively used me as a means of social support to re-engage with the network, and they started doing their first journeys with me again. Yeah. And that really evidently had a positive impact on the lives of people who really haven't been out of their house for a couple of years. So that sort of stuff, I think, is just the absolute bread and butter of what good research can do, because the reality is we're in a context where I am able to do that, and that's seen as a legitimate part of my job if I were to do that. Whereas for social services, it's like they have to make a case for doing that. So I think if you can think about like those small interactions and small engagements with people on their terms, if we think about the group that you want to engage with, well, what are the things that they would like to do and would enjoy doing and would genuinely benefit them? If you go to them with a proposition of like, we're going to have a good time and you're going to get something out of it, that's far nicer than trying to work backwards.
And I think building that into your papers, into your next grant application, because I feel the same. I in a couple of weeks' time, I'll have to produce my annual report for Dementia Researcher, and I've got statistics coming out my ears. I can say how many people joined the community. I can say how many people turned up to our webinars. But the really inspirational bits that certainly that motivate me aren't the stats or how many people listened or whatever. It's little stories. When you find out somebody got their job because they saw it on our website, or somebody changed some bit of practice or got a grant or found a collaborator through it. And it's those little bits that actually are really motivating. I think adding in those qualitative elements into your assessment, so you don't worry about, you go from this, don't you, down to this. I think picking out those little pieces are important. Patricia, I'm conscious that in Ireland, of course, I don't think I'm completely stereotyping here, but I from the rural community engagements I've had with people living in Ireland, they're not necessarily big on going in and using services either, are they? I mean, it's family support networks, it's communities. How do you reach into those communities as well, that I think others would certainly say were not necessarily easy to engage with services? Oh, you're on mute, Patricia, sorry.
That's exactly right. So that was one of the difficulties, was that there were no dementia services in the local community. So it was about bringing them in, about incorporating that into, bringing that into the community centre and bringing people into the community centre. And that was the hub of the community. And so that was the real base. So finding where they are and bringing them in. And then that drew in more local dementia charities. So about bringing those services in and helping people better engage, because we didn't have any support, and now we do, and because we do, I would love for this to roll out to other communities. So finding that hub, I was very privileged that the lady in the community centre had 20 years of experience about how community works within the centre, and was then able to. So my experience with dementia, I was able to help support her on that side, with the dementia side. And
so engaging with others working in that space. So John, I guess to answer your question is you're not the only person, I guess, trying to engage with the LGBTQ plus community on a social issue. And so maybe look to other areas of society that are also wanting to engage with that community and learn lessons from them as well. So whether that's looking at, I don't know, what kind of campaigns have targeted that community in the past. Well, I mean, everybody has, hasn't it? I mean, that's a particular community that everybody's wanted to engage with on different issues because we have poor engagement. So look into those for some inspiration as well. Like, I guess, Patricia, you've had to as well. And I remember as well so back a long time ago, I was one of the people that started something called Enabling Research in Care Homes, this enriched network across England, Scotland now as well. And one of the first things, when care homes were reluctant to get involved in research I mean, I don't know if it's still the case now. I imagine it's improved, maybe not that much. And giving them a reason to do it, something. And I think that's from yours, James. I think helping people re-engage with public transport was a reason why people would, because they were going to get something out of it. I mean, not selfishly, they were going to get something, but I think give people a reason to do it. And it's not just good enough to say, oh, we want your opinion, because they're not going to, some people don't say, well, oh yeah, who's going to listen to me? I think you've got to, I can imagine, James, if you'd gone to the community you were working with to say, oh, come and tell us your thoughts because it'll make a difference to policy. Would that have made a difference to them? Would that have suddenly been the motivator for them to come? Or yours even, Patricia?
Well, I'm thinking my work happened in the context of the 15-minute cities for Raw. So I think if you were to ask many of my participants about politicians and the idea of engaging with local policy, they'd have slammed the door in your face.
Yes.
So yeah, it is a good point in terms of how you go about engaging. Yeah.
I think particularly those kind of minoritized communities as well, more so. I mean, we know that research is over participated in by kind of white middle class people. And if you really want to reach other people, you've got to give them a bloody good reason to do it. And that's not to say that they're selfish or won't, don't want to help others. Of course they do, but their time, they value their time more, don't they? I don't know. Is that your experience, Patricia?
I think that there's community groups that work specifically with other, groups of people that, and they're expert in that and how to better engage and know who they are and what their needs are. So I think engaging, if you find those community groups that specifically work with those particular groups of people, whatever you want to direct your research, I think that you may be able to tap into that expertise.
Yeah, absolutely. We've got a question from Josie, who is the coordinator of our low and middle income country, our LMI. Low Resource Settings Journal Club. Sorry, Josie, misquoted there. We've got a journal club for researchers working in low resource settings or for research in that space. If anybody's interested in that journal club, Josie's group is looking for new members. And that isn't just overseas. Low resource settings can be where you are, even in the UK. And she said, I really like the idea of incorporating resources from study grants to communities, but worries a little bit about sustainability and when the grant ends, which I think is, I don't think it's an easy answer to that. Is that is true? I don't know if you'd agree, James. That is the reality.
Yeah, I mean, you need to be. I guess firstly, you need to decide for yourself whether it's the old better to have loved and lost than never loved at all thing, right? Like, is it better for us to have several nice bush rides together and then I'm gone? But is that better than if that never happened at all? It's different for different people, so there's that to be weighed up. But most importantly, being super honest and upfront in terms of, I mean, whenever I approach any potential partner at all, my whole spiel begins with, this is the reality of the grant ecosystem that I live in. Like, this is how long it takes to get it. This is what you get. This is how it ends. So I think that in terms of being very, very upfront, because that is the grant cycle, and it isn't sustainable, and people always, obviously for very good reasons, worry about sustainability. I guess because I am interested in that like immediate positive experience, then for me it seems like a worthwhile positive thing that improves someone's life, despite the fact that that inevitably ends, as all things do. Yeah.
I think that sounds to me like a healthy attitude, doesn't it? Because I honestly, I went to I can't name names because this will eventually end up on YouTube. I went to something recently where it was about falls prevention. And there was one particular study there where this same study had been going on for the best part of a decade. And what they'd learned at the end of 10 years wasn't that much more than what they'd learned at the end of the year. But the only way they could keep that beneficial work they'd done was through keeping it as a study and getting new funding to continue it as more and more research. And I guess you can either do that because it's a topic you're passionate about, or I guess if you're not in that position, there does come a point where you say, I just can't get funding for this anymore. We're going to have to, that's it. We have to park this now and move on because falls is not important anymore, because funders increasingly these days tell you what they want you to research, don't they? The funding calls are saying it's for this. Apart from funders, particularly like, I guess, even Alzheimer's Society increasingly have themed calls, particularly. The NIHR, I guess, with their research for patient benefit programs, and I guess in biomedical research and in fundamental science, it's a bit different. They do open you up to saying what you want the research to be about. But I think this is wonderful. I've got a few final points I'm going to make because we're nearly at the hour and we didn't get a chance to go into the chat today. But do continue to send your questions if you have them. The points I had here were, so this is brilliant. I love the fact that we've got this as a different perspective. That James, you've kind of absolutely changed opened my eyes on this topic. And Patricia, your work in the community is really inspirational. You've both done amazing things in different spaces. So to recap, if you like, what is civil engagement? So this is what I could find from the internet. So volunteering. Civil engagement is number one, volunteering. And if you look on Alzheimer's Society's website, if you look on Alzheimer Research UK website or Alzheimer Scotland or any of the dementia charities, Age UK, all of these places have volunteering opportunities. I mean, even volunteering at your local library where they look after older people, or in the local charity shop, or helping older people move around, whatever it is, there will be volunteering opportunities where you are. And the great thing about that is that it's already there. It's organized. You don't have to, you just have to go find it and say, I'd like to do this. And they're desperate for people to help. You've, of course, then got your advocacy work, which is campaigning for that social, political reasons. And I think you are expert researchers in your field. And if you, I mean, you could consider that part of your job is advocating for changes according to what your research is telling you. So that can easily be part of your job. And whether you can build that into your research if you're lucky enough, or look for opportunities to share your knowledge with other people, or talk about the experience, you know, helping amplify the voices of people living with dementia you work with through the platform you have as a researcher. That's another way of doing this. My list came up with voting as well. Civically, vote for the people who are going to do the things you want to do. Public participation. So, I mean, actually attending these things, attending town hall meetings, participating in public consultations, engaging in discussions on dementia and other issues. So when we do see these policy conversations coming up, actually don't think that your opinion isn't important. Don't leave it to somebody else to make the points that you might be shouting at the television about. Actually go out of your way to make those opinions public. Community organizing, which Patricia is a brilliant demonstration of, is going out of your way, using your time, working collectively to address those shared concerns that might be there in your community or with the people you're wanting to engage with. So, John, obviously you told us that part of your research is looking at care homes with queer men. Is go out your way perhaps to set up a online Facebook group for LGBTQ plus men in care settings. I don't know. I don't do that. I mean, do if you want, but you get my point. Is whether it's setting up a community group in your area, whether it's doing something online, but use that motivation to do something. Education, spreading awareness about important issues. Again, Patricia's work and James's on public transport and policy work and on brain health. And then policy engagement is, if you're in the UK particularly, but I know this happens in the US, the Royal Society, we did a webinar, a podcast ages ago with the Royal Society. Have this engagement program where they'll pair up researchers with policymakers for a couple of weeks, and they follow each other around and learn from each other on how to influence policy. And one of the things that we talked about that was the what do you call them? The groups that meet in Parliament to talk about specific issues. The
all-party parliamentary.
The parliamentary kind of groups. But there's a website for this. I'll try and find it and put it in the links afterwards. They literally run consultations almost constantly, but it's very much under the radar. They don't tweet about this. They just publish these things on the website. So do any experts have an opinion on this? Take time out to do that. Engage with policymakers, and you know, if you see something not being done well in your area, whether that's poor public transport, whether it's lack of support for older people, write to your MP, write to your local representative, write to your local council and say, hey, what the hell are you doing about this? I'm an expert in this area, or I know experts. Can we talk about this? It won't change if you don't take that step to do that. And whether you can build that into part of your job or whether you can do that as a private citizen, I think is possible. Reasons why? Well, I think this can massively contribute to your own well-being. I think we all get a little bit down, and having that feeling that you're contributing, particularly when your research isn't necessarily going well, I think is good for your own well-being. Very motivating. Certainly I find it. Selfishly, this stuff looks great on your narrative CV. We did a webinar on narrative CVs a few weeks ago. When you're asked about what contribution you're making, not just to your lab, this is gold for your narrative CV. It also means that you're just being a good human being, right? I mean, just being a good human being and actually putting your skills to use to contribute towards that wider community piece. My work is with you as researchers, not necessarily directly with people with experience, but you know, it's nice to be able to do that, and it's worthwhile. I'm going to give you both a chance to final thoughts, motivations from the two of you. Patricia, any final thoughts, tips for somebody who's just one tip for somebody who's getting involved in civil engagement for the first time? Oh, we can't hear you for some reason, but you're not on mute.
Hello, can you hear me now?
Yes, we can. Oh, no, we can't again. It's gone. James, you go. While we're waiting. Well, let's see if Patricia, we'll come back to Patricia.
I always come back to this point of it's quite fun. Like it's fun to do this sort of good stuff, right? Like it's quite nice. And I think often if you're having fun, it means your participants are as well. The people that you're working with are, so you sort of, you know, you're onto a good thing for everyone, really.
I love that. And don't necessarily worry. I love your point about not necessarily worrying if what you're doing is going to last forever. The fact that you're there that day, helping somebody today, I think is a really important message. And I guess, Patricia, you see that all the time in your space as well.
Yeah, if you can hear me. Can you? Yeah, definitely. I just think go for it. And there's so much to learn. And I've learned so much that I can then apply and to make me a better scientist. So there's so much to give, but there's also so much to get from these experiences and the people that you meet and the changes that you can make.
Thank you very much. You've both been amazing speakers. I'm really pleased that this topic was added to the program. I found this motivating. I hope you all have too. I'd like to thank my brilliant guest, Dr. Patricia Kelly, and the amazing Dr. James Rupert Fletcher. You've been watching the Dementia Researcher Salon. We have one session left before Christmas, which is on doing a PhD as a mature student. Where we've got Elise Parkinson and James from Liverpool. So Elise's surname's dropped out of my head. James from Liverpool and Elise from Norwich, Cambridge, talking to that topic this time next Wednesday. Thank you so much again. I will ask James and Patricia, will get links to their work as well and their things, and we'll post those in the chat at the end, and I'll find the one on the Royal Society stuff that I mentioned before, and we'll also dig out some from some volunteering opportunities if we can find them. So wherever you are in the world, I think you can make a difference, and thank you very much for joining us today. Thank you.
Thank you.